Celia Hatton there speaking a little earlier. Well, I'm now joined by Wenhao Mao. She's a fellow at the Global Health Institute of Duke University in North Carolina, and she specializes in Chinese health reform and policies. What's your assessment of the policies that have been put in place since this outbreak?
Yeah, thank you for having me here. So I think generally the Chinese government take quick action and powerful engagement to control the disease outbreak in Hubei. However, I think there is some limitation at the health system level to make the implementation of this policy take a little bit longer to control the disease.
Well, Wenhui Mao, you've been studying the Chinese healthcare system since SARS. Do you think they've put enough money? Have authorities pumped enough money into the Chinese healthcare system since then in order to be able to handle this outbreak?
Yeah, that's a great question. So actually, we have a term, we call it cycles of panic and neglect. You can imagine after the outbreak of SARS in 2003, Chinese government invests huge amount of money to rebuild this system, and it works quite well. However, for several years, the funding for public health sector reduced, and recent year it dropped down to 5% or even lower. So in this outbreak, we don't have enough staff from public health sector to track the disease, to cut the infections chain to control the disease. So that's the one problem of the health system currently.
Well, you know, when you see the images of these new hospitals being built, but at the same time, the ones that are in place being overwhelmed with new patients, the medical facilities and doctors there also appear to be extremely overwhelmed. How well do you think they can manage this crisis?
Yeah, let's go back to the structure of the health system again. So I have a triangle on my hand. Ideally, the good health system is have a sound base of primary care at the bottom. And people need basic care can be satisfied at the primary level, and people need specialized care like transfer to the top level. Unfortunately, in China, the system is more like this way. So people bypass the primary level to the top hospital, which make the doctors at hospital have too much burden. And in this system, we have to build this new hospital to treat the patients with the coronavirus right now. So that's because the primary sector is relatively weak. And if they can take more responsibility of treating patients with other disease, this will definitely relieve the burden of the doctors faced right now.
That's a fascinating way to describe it, Wenhui. How do you think authorities should proceed in terms of their public health management of this?
I would say it's in the right direction, but lack of some of the details or supporting policies.
Wenhui Mao there speaking to us from the Global Health Institute of Duke University in North Carolina. Thank you very much.